Gary Scheiner, owner and clinical director of Integrated Diabetes Services in Wynwood, Pennsylvania. Well, for preventing blood sugar spikes after meals, we have a variety of different ways we can look at it. The reason the spikes occur is because for people who take insulin at meal times, the insulin is too slow to cover the blood sugar rise that occurs after meals. Food digests faster than the insulin works. A healthy pancreas that secretes insulin at a mealtime, that insulin works almost instantly, within seconds. But when we take insulin by injection or with a pump, it takes hours for that insulin to work. So there's a lag time. So we're looking for ways to either make the insulin work faster or the food work slower to try to get the times lined up a little bit better. There are a number of ways to get the insulin to work faster. First, we always encourage use of a rapid-acting insulin. People who use regular insulin at meal times are doing themselves a disservice. It's too slow to work, much too slow. The rapid-acting analog insulins are faster. Lispro, aspartin, glulysine are the three rapid-acting insulins that we have. We have a new insulin called Afrezza. It's an inhaled insulin. And when we inhale this insulin, it absorbs and works even faster than when it's injected. So that's another means for getting the insulin to work quicker, is taking it with this special inhaler. We found that warming the site where the insulin is given will accelerate its absorption and action. And that can be accomplished by rubbing the site, by taking a hot shower, a warm bath after the insulin is given. One can also just put a hot compress on the site for a few minutes. That'll accelerate the action. And physical activity is another way to accelerate the insulin activity. Exercising the muscle that underlies the fat where the insulin was injected will make that insulin absorb more quickly. We can reduce the peak time a good 15, 20, 30 minutes and hopefully improve the post-meal control. So those are some of the ways we accelerate the insulin, get it to work faster. The other strategies deal with getting the food to work more slowly, and there's a number of creative ways we can do that. I think one of the easiest things to do is just timing the insulin so that it's earlier. If a meal is planned at 8 o'clock, we don't have to wait till 8 o'clock to take the insulin. In fact, it's best to take that insulin 15, 20, even 30 minutes ahead of time, so that the insulin has a chance to get a running start, so that when the food kicks in, it's there to match it. So we call that pre-dosing, giving the insulin ahead of time, which is generally safe to do as long as your blood sugar is not low going into the meal. Speaking of which, hypoglycemia is something that also contributes to blood sugar spikes, so avoiding lows going into meals is very helpful. Slowing down food can be done a number of ways. We can choose foods that are naturally slow at raising blood sugar. For example, if someone has cereal for breakfast, which is a very high glycemic index food, it raises the blood sugar very quickly. Switching to oatmeal or yogurt or berries in the morning or nuts have a much slower action on the blood sugar. They take a few more hours to digest. So we don't see the spike that way. We have a lot of our patients splitting their meals. When they give their mealtime insulin, instead of eating their meal all at one time, they break the meal into a few parts. So they can have part of the meal, say 15 minutes after the insulin is given, and save the rest to have as a snack an hour, hour and a half later. That way there's less of a rise right after the meal and then less of a drop a few hours later. Acidity is something else that slows down the rate of digestion. Vinegar is an ingredient that can keep food from digesting very quickly. Other acidic foods like tomatoes, sourdough products will slow down the rate of digestion as well. And lastly, we have a series of medications that are effective at slowing digestion. One of which is a class of injectable meds called GLP-1 medications. These are medications that mimic a hormone that the body would normally make, but it slows down the rate of digestion. It also blunts glucagon production by the pancreas. So it does a couple of things to help control the post-meal readings. Also, replacing a hormone called amylin with an injectable can do the same thing. that's a medication that significantly slows digestion and prevents the post-meal peaks.